Let's move to our next guest who leads operations at a regional health plan that has consistently achieved the highest performance rating against possible for CMS. Jessica Vander Zanden is the VP of Operations at Network Health, a Wisconsin-based plan known for its commitment to both the provider and the consumer experience. We're going to do this a little bit differently. We're not going to do a slide presentation here. We're just going to have a two-way kind of a little bit of a quick interview format here, where we're going to talk about two standout strategies that Jessica and her team have implemented. First, how providers are treated like customers at Network Health, and second, and how they do that and what the impact's been. And second, we're going to talk about how a transformed call center has become an incredible differentiator for CAHPS and Star Ratings, and how they achieve that as well. So we're going to get into that. Jessica, are you here? I can't see you.
Can you see me?
There you go. Good. All right.
Good.
Great.
Maybe just
I have two screens here. I have my notes and some of my questions in front of me, and you're to my right. I couldn't find you.
You're
okay.
Good.
So let's start. Let's start and talk about, it's harder and harder to sustain. It's always been hard to get to 5 stars, and it's becoming harder and harder to sustain it.
Yes.
So how is the organization accomplishing this, and what is the overall provider engagement and experience strategy?
Yeah. So first of all, thanks, Eric, for having me this morning. I'll start first broad with our infrastructure, which I think is core for us from a Star Ratings perspective. So we drive a high level of accountability across the STARS program. So what I mean by that is every single measure has an owner across the plan. And as CMS changes those Star Ratings, to your point, they get more difficult every year. We continue to refine that model that we have, and it's been very instrumental in our success to have that cross-functional team who's coordinated together, studying these measures together. And obviously it's big. We're big on the data. So we're watching all throughout the year to see where we're tracking across stars. A big part of that.
What does that look like, Jessica?
Sure.
So what does that look like when you say accountability across all star requirements? Can you give a quick example of what that looks like in with one requirement?
Sure. So I'll start with CAHPS because that's my area. I've got the call center reporting up through me. So we have a CAHPS team, and we're focused specifically on all the measures for CAHPS. It's a cross-functional team because CAHPS isn't just influenced by the call center, right? Anyone that interacts with your members has the ability to either improve or potentially detract from your CAHPS. So that team is studying the measures, and then we're doing pulse surveys throughout the year to see how are we doing, how are we tracking, in order to get the outcome that we want at the end of the year, which has been successful for us to be monitoring that closely. So it was 4 years in a row, 5-star, 4 years in a row, customer service 5-star specifically. So, it's a big part of our model overall. As you mentioned, our differentiator in the market is high service. And that has really, have been a core cornerstone of the STARS program, specifically around CAHPS. But that's across, there's the HAS measures, there's all of the different areas, functional focus areas. And we have cross-functional teams that are reviewing data throughout the year and tracking. It's not something, STARS is an everyday, it has to be an everyday focus in your plan. And it has to be across the organization. The other piece I would add to that is from the top down, individuals in Network Health understand how they impact stars. We've spent years, our team has done a great job educating us in what our role is. And if you're all pointing towards that same goal, you tend to get better results, right? Everyone understands what can I do to influence star ratings? And that's been really important, important component of our success across the board.
Okay, so let me summarize those two things. The first is you take every single accountability or requirement of stars, and you draft a team, a cross-functional, use a sports little analogy, for each requirement. So now you have multiple teams for each requirement. That's number one. Yep. That's a big sort of operational, functional kind of component of Network Health. And the second, which sounds very cultural, and I think is super smart, is everyone in their role, my guess is whether they're just sweeping floors or whether they're in charge of the call center or in clinical quality, knows specifically how their job impacts particular star ratings.
Yep, correct.
All right,
Yep.
keep on rolling. This is great.
You got it. The other area before I switch over to the provider strategy overall is really our focus on excellent service, and that really starts with our employees that we hire. So we've got pretty specific requirements for what we're looking for to join our team at Network Health, and that again is from the top down. So we focus a lot on that cultural fit and ensuring that we have the right people that fit our model, who have a service mindset and want to serve members. Our call center has excellent outcomes with that kind of focus, but that's all across the plan. So if you don't have engaged employees, you're not going to have engaged members to be able to make those connections. So it really starts with our people, which is, like a cornerstone of Network Health. That could probably be another whole talk, Eric. But
I was just thinking, I have a follow.
Focused on our people and our culture and what it means to work at Network Health and what that means for the members. And then finally,
hold on, before you leave that, sure. You're right. Use a full episode, and I'm totally going to take us off time. So I love focus on customer service and your hiring strategy for each individual to ensure there's a cultural fit and a commitment towards servicing the member. How do you do that? Is there a particular proprietary kind of survey you've unearthed? Because everyone could say the right things if they want a job as far as what they care about. Is there something you do? You don't have to give up any proprietary information.
Sure.
About how you identify if Eric Glazer, who's interviewing for a role, is going to be a cultural fit?
Yeah, so we have specific criteria that we've defined as the Network Health Way, which I won't get into all of what that looks like, but we're interviewing, not just the basic questions like what your experience is, how do you handle tough situations, some of those generic questions. We want to know that too about you, but we also specifically drill into those behavioral characteristics that would make you a good fit for Network Health. So we've defined what that means, educated across the organization. We're all on the same page. And then that starts with our HR team all the way through our leadership team, and really, feeds into how we're looking at our employees and how we're evaluating our employees over time. So, and it's been a very successful model for us, and we get it. I mean, we get it right. You can see by the numbers, by the commitment we have of our employees to Network Health, the retention rate we have as an organization overall has seen success from having that type of, very granular focus on what it means to work at Network Health and what it takes to work at Network Health. So I'll transition just a bit from that topic into the provider strategy. So it was perfect. I loved Kim's presentation because she hit on some of the core things that we focus on at Network Health. Specifically, we spend a lot of time managing the relationship. So we're provider owned. So our bosses, our providers, right? We're owned by Freighter Theta Care Health, a very large system that spreads now across the eastern part of Wisconsin. And so we need to be provider focused. It's not just a desire of our health plan for better success. It's a demand of our owners, and that makes sense and has been successful for us to focus that way. So it really starts our program and strategy starts with the relationships we have with the providers. One, very core piece of feedback that we consistently get from providers, including our owners, but all provider systems, is each health plan wants us to do something different, right? You're asking us all to do it different. We don't have time. When the doctor's in the office, we can't do it this way for this plan and this way for this plan. So we try to fit within their process flows. We spend a lot of time on the intake side of things, especially as CMS changes their ratings. How can we make this work? It's mutually beneficial. The results, the goal that we have, which they have a goal of better care, also one of our goals, better care and consistent care and cost-effective care. So we align our goals up front and then focus on how we can make our processes and the things that we're trying to achieve fit into their process flows. Big driver of that, of course, is data. And it has to be data that they believe in and that they trust. So part of the big focus of those teams is spending a lot of time talking through that data. If they're questioning something, we're going to walk through it with them. We're not just going to say, here's the data, this is what it is. This is where it came from. What are you questioning? What do you see that's different on your side? So spending a lot of time making sure that the data is reliable, adjusting things if we need to. Additionally, I think one of the things that our providers consistently give us positive feedback is that we're flexible. And what I mean by that are in time, I'll give you a couple examples. So we've had 2 large systems in Wisconsin that have had major cyber breaches, right? Just a disaster, horrible for patient access, horrible experience across the healthcare system. And they're not able to follow our specific policies there during that time of stress. So we've reached out to them. How can we help? How can we be more flexible? If it's giving more time for claim submission, working together on what we're seeing on our end, even assisting members who need to get access to care during that critical time. How can we assist you? How can we show up and assist you in those times of need? And then be flexible with policies, right? Our ultimate goal is providing better care. Us being too stringent when a provider system is strained by, really unfortunate situation doesn't serve our mission and doesn't meet their expectations either. Additional example would be.
Can I ask about that? So sure. That sounds great that you're sort of flexible, customized, personalized for every, we'll call it client. If we treat providers like clients, I'll call them clients. So hospital system A, data breach, you sit down with them, you figure out what they really need in a personalized way around sort of your partnership. And then hospital system B, data breach, they have their own requirements. Is that a sustainable business model? Or how are you able to pull that off and keep the business healthy without drowning yourself in just resource costs?
Yeah, it's our staffing model supports having, so our provider contract team is assigned to each of these systems. So we have a point person assigned to the systems to be able to interact with them. And if they have questions, that's who's serving as the front line. So almost like having an account manager assigned to the provider system. And it, like I said, our goal, we have to focus on what our goal is. If they're not able to provide care and it's going to put a strain on the system because we're not willing to pay because they had a cyber breach and they can't meet our requirements, that hurts the system, hurts the care that we're providing, hurts the service to the member. So it doesn't meet the overall goal. So the model that we have set up is sustainable, and it does promote replication. So when something works with the system, we have multiple clinically integrated systems that we partner with. We are able to apply the practices that work well across the systems. So it's a win for us too, to be able to be flexible and model things and then take it across, the systems that we're clinically integrated with. So far we have been successful. I do believe it's sustainable, and honestly, it's the right kind of work that meets our mission. We want to be proactive and helpful in creating healthy communities. This is how you do it. You have to have collaboration between your providers who are providing the care to your members. We're ultimately focused on the same end goal, and by doing that, the provider system trusts us, right? We have a relationship that's built around trust, which allows you then to take your clinical integration program to the next level. So it started with a lot of relationship building, being flexible, being a provider a health plan they want to work with. We started there before we got into the discussions around, okay, let's maybe talk about risk and maybe you taking some risk as it relates. So you can't just jump to that. You're probably not going to get very far, because this then becomes a collaborative relationship. We share in those financial results. So we're making sure our goals are aligned with the system. The goals that we have often are very similar for all of their financial goals, and it meets, right? Getting patients in when they need to be seen from the coding perspective on our side. Those same patients otherwise might have, they might not get care when they need it, and then they end up, in the ER. That's not helpful for the healthcare system either. So aligning what those goals look like and using data, reliable data, to target who we should be focused on. And partnering with them and supporting them through that data. So it's got to be actionable results. They don't just want a bunch of reports they don't understand that they have to sort through. So, our data team spends a lot of time refining what we're providing, taking their feedback, talking them through what that looks like, so that everyone's on the same page. I think the one thing that I didn't thread into this, which Kim touched on a little bit too, but we do provider surveys. We take that feedback very seriously. And then additionally, that provider account manager that I talked about, they're actually going to these clinics. We have this model works for us. We're in 26 counties in Wisconsin. We have those practice managers actually doing on-sites or bringing them to our facility and having conversation. How can we do better? How can we partner better? at least once a year that's happening across the provider system, which we learn so much during those meetings, things that we can change, things that we can do better. We're able to also give them feedback. Did you know instead of calling the health plan, you can go online and use our portal? That serves my team because then as less calls into my call center from providers, I can focus on members. So having those types of conversations in person and showing them how they can work easier and more efficiently, it's back to that win-win and that collaborative, alignment of what our goals are.
Can I summarize what I've heard just now?
Yeah.
And folks, I'm taking diligent notes if you're not. So for these interview type segments that we're doing today, if you want a copy of my notes, they're not going to be pretty, but happy to provide those to you guys with whoever slides we get as well. So far, Jess, this is what I've heard. What we finally got on topic, and I know we talked a little bit about hiring and some of the things that we're talking about treating the provider like a customer. So number one, when the strategy starts with providers and listening to what providers say, saying, hey, each health plan wants us to do something different, help us out here. So sort of number one that I wrote down is accommodate what the provider group needs so that it's easy to work with you guys.
Mm-hmm.
You do that in part by, so this falls sort of as a sub-bullet, by having a practice management exec representing the health plan for each provider group that you work with.
Mm-hmm.
Okay, so that's number one.
Yep.
Two, I put separate, you could argue it's related, but is flexibility. So if a larger health system needs some personalization or customization because of something that's going on with their system, we use the data breach as an example, then you got to have customization policies and capabilities.
Yep.
So that's number two. Three, you said reliable data and you went in, I think you mentioned the term clinical integration. So having really making sure you're committing resources and capabilities internally, which most health plans should have, to have a really good clinical integration program to support the partnership and the overall clinical operations. And then the fourth that I just heard, and I guess it's a bit of a strategy that the practice management exec has to execute, is assuring and establishing goal alignment of goals.
Yep.
Okay.
Yep. No, I think you did great. Yeah.
Okay. Keep on rolling. I just wanted to make sure actually, let me do this because I don't want to interrupt more than I have to. I have one administrative kind of PSA, so just bear with me. I just want to remind folks who are listening, we're executing this summit in partnership with two great partners, Navina and Tata Care. I want to tell you, since we're on the topic of the provider, a little bit about our partner, Navina. You can check them out again at navina.ai. They are a really cutting edge organization around clinician-first AI tools. And they have a co-pilot for value-based care that was recently named best in class for clinical digital workflows. And what they do is they turn fragmented patient data into actionable clinical insights right at the point of care. And what this enables is natively integrated clinical workflows where you're taking data, putting it into the workflows, and the co-pilot helps improve the provider and the practice's ability for risk adjustment, quality metrics, and overall population health, and dramatically reduces the administrative burden, largely AI fueled. So they're doing a lot of cool things along this topic. You should check them out at navina.ai. If you want an introduction to some of their team, I've gotten to meet a lot of them. You could ping me directly on direct message on Zoom or email me at eglazer@brightspotsventures.com. They have more than 10,000 clinicians and care team members across 1,300 clinics using them. Lots of value-based organizations like Privia and Agilon and Millennium Physician Group all using them. So check them out at navina.ai. And thanks, Navina, for partnering with us on such a cool event today. So let's keep on going, Jess, and keep on touch. Should we keep on getting it?
Yeah, well, and I'm ready. I hit on all my core high points. We can go deeper on anything that you want to that I've mentioned, but otherwise I'm ready, given the time, if you want to flip to making the call to the health plan and focus on, the high level experience we provide to members.
I suppose and tell me if we didn't go into this deep enough before we leave train providers. like customers. We talked about goal alignment. Did we go deep enough into incentive alignment and how you got?
So I think, I mean, like I touched on it, our strategy overall, and that was really starting small on that incentive program, and it's continued to build over time. So even the first year that you do it, it's not typical that a provider is going to want to go all in across lines of business. So we started small, selected one line of business, started there where it would be of most value to us and value to the provider systems, and then have taken those arrangements and have extended it into other lines of business across those provider systems. So again, this work needs to be really intentional, and it takes time. You have to have the trust in the foundation and the belief in the data before you can even start talking about those next stages in your program. But I think that's the piece that I would really highlight, is getting into then where those and then making sure you take the time to discuss, because there's going to be debate, right? There's going to be debate around how that should work, how the alignment should work, the timing of the data and the timing of attribution. What does it mean to be attributed to our system? You have to have all of that. And ideally, you're doing that ahead of time, right? That's not something you want to debate at the end of the year when the numbers are coming in and your payout. You want it to be a clean program that is clear to both sides, so everyone is in agreement with what the goals are. And then the other piece is, which I've threaded through, actionable data throughout the year, right? This isn't something where you just have it at the beginning of the year and the end. They need to know progress. They need to know how they're doing. And that takes a dedicated group of people to be pulling that data and making sure that we're consistently, treating that's our customer. Like you opened the section with. If you have to treat them like a customer. If the customer wants more data, they want more time with us, they have more questions, we have to be there ready to serve, right? That's kind of the difference. It's not transactional, it's a relationship.
And just so that I want people to understand this can be done even if you're not owned by a provider. What percentage of the provider groups that you're working with are part of your corporate family, and there's a bunch of outside provider groups.
There's a bunch of outside providers. Yeah, I mean, they're just one of, and I don't have the percentage for you of attributed lives like off the top of my head, but they're one. We have many systems that we are not owned. We only have a contractual relationship with them. We're also not across most of our lines of business, in particular Medicare. We're not an HMO. We're a PPO plan, so you can go in or out of network, which can bring in additional challenges. It was said years ago, I would go to conferences, that PPO plans will never be 5-star. And here we are 4 years in a row as a PPO plan 5-star. But it does create extra work, right? A little bit of extra work with the clinical integrated focus, because you need to ensure that you have those aligned incentives and you're getting the results through those relationships where you can, because we will have members not going in network, where we have a little less leverage over those relations. That's the whole nother talk, is how to handle, members that go out of network and how you partner with systems you're not connected with through a contract and what that looks like. But yeah, so it's several different systems. This is not specific to our owners. We do have the unique opportunity in some cases to pilot more with our owners, which we take that opportunity when we can and when it makes sense. But we've also piloted with non-owner systems. We have several. Large percentage of our membership does not go, doesn't live in a place to go to where our members, or to where our provider owners are focused. So yeah, it's a much larger program than that.
Okay, in the short amount of time we have, I know that was awesome and really interesting. We have a couple of episodes there too. So yeah. What's the one strategy or program that Network Health has prioritized that you think, if you were going to build your own 5-star plan or take over a health plan, like what's the one thing you should prioritize that you think is just absolutely essential in achieving the performance that Network Health has?
So our vision statement includes creating exceptional experiences. And I would say that has been our North Star across all of our focus areas. So whether we're talking providers, we want it to be an exceptional experience of working with a health plan. And this is health insurance. Oftentimes we don't have the best reputation, and I mean, we're a little better than I think car insurance, but not great, right? There's not a lot of people that want to call their health insurance plan, not a lot of providers that are dying to negotiate with the insurance company, but we want to be unique. And that foundation and focus really drives all the other strategies that we have. It's a strategic pillar that we have goals and tactics around that goes all the way up to our board, specifically focused on experience. It sits right along our financial goal, all of the other goals, and we present what is the core areas that we're focusing on to provide a better experience for the providers. And obviously, most importantly, to provide a better experience for our members. And I would say for us foundationally, that's where we always start. That's what we go back to when we're making decisions. We're going to implement new technology. What is the impact to the providers, or provider owners in particular, but to the providers in general? And then most importantly, how does this impact the member? How does it make something better for the member? How can we leverage it to be better for the member? If you keep that at the center of your focus, then 5-star, it fits underneath that umbrella. We're also 5-star from an NCQA perspective. So that is also tied to all of this foundation. But I would say that, really is the center of everything that we're doing.
That's great. Do you want to get into anything? I know it's short. Just give us a quick tease about, how you're thinking.
Yeah, so our second was just really on CAHPS, right? Focusing on CAHPS and that experience. So what I would say, just I'm listening to this, what's some low-hanging fruit? We focus on ensuring that the reps that work in our call center that their job is easy to do, as easy as possible. It's a hard job working in customer service. So focusing on the technology, making sure they have the tools. Second, making sure they have the training. And then I would say third, making sure that they have the incentive to do a good job as well. So we have incentive programs, which is kind of unique within our call center, so that those employees stay motivated, that keeps them sticky. We have a really great retention rate. We have less than 10% attrition rate in our call center. It matches the rest of our organization. So we don't have a high turnover rate there. And that's by intention and our focus on ensuring our culture is a place you want to be. You're not going to create an exceptional experience for a member if you're not having an exceptional experience at work. So foundationally, that's how we operate and how we focus. So
yeah, I love that. I don't know the book. So when you're saying this, so just to give a quick couple of recommendations to people listening, if they're trying to push or support their organization to convert to this exceptional experience culture, which is easily said and so hard to do. I know from firsthand experience of having a family member who spent about 10 years working at Southwest years ago when Herb Keller was still in charge, how much resources Southwest put into their employee culture, because Herb's overall strategy was, if I provide great service to my employees, they're going to provide great service to my customers. So I don't know the book that brought this up, but there's a book out there at Southwest Airlines that kind of talks about this.
Yep.
And if airline can do it, I think a health plan can potentially do it too, right?
Agree. Yep.
And I'll put another one, or I'll have the team put another one in the chat, but there's one on restaurants that I just read around Madison Park, the famous restaurant. I'll put that book in there too. I just finished reading it about a year ago. It's the same type of innovation around creating a remarkable customer. It's just resonating with me as you were speaking. So this was great. Appreciate it. I'm gonna try to keep us right on time here and bring on our next guest. So I really appreciate this, Jessica. Thanks so much, and we'll follow up with you some more questions at the panel.